All right, everybody. I have on Dr. Katie Zaremba on the podcast. And as a lot of my guests that I've been bringing on lately, I found on Instagram and connected with and love their content. And I'm like, this is so cool. We should talk about this on the podcast. She works with fertility, trying to conceive, and hormones, but dives into a lot of root causes, underlying issues, things that aren't even talked about, things that I've never even heard. And so I'm really excited to dive into this conversation. So thank you so much for coming on the podcast.
Yeah, thank you for having me. My name again is Dr. Katie Zaremba, and my focus is in fertility and couples that are trying to conceive and maybe people that have had miscarriages. I got into this area when I had a lot of friends who were dealing with fertility struggles, and I was like, this is not normal. There has to be another way to help them without going straight into very invasive procedures. So that's kind of how I got into it. And the first patient I had that got a positive pregnancy test after dealing with infertility, I was like, this is what I need to do. So that's kind of how I got into this area. I work with women to kind of pinpoint the underlying cause of their infertility, and what makes this a challenging area, but also an interesting area for myself to work in is all of these causes are generally different from person to person. They might have very similar symptoms of I've been trying to conceive for a year and a half and I can't get pregnant, or I've had, 3 miscarriages, and that might be very similar across patients, but what is causing those things varies drastically from person to person. So I kind of work as a detective essentially to uncover what's causing these issues and treat them so that they can get pregnant and maintain a healthy pregnancy as well.
Yeah, that's so interesting. Do you work alongside like IVF doctors or anything like that? Or is it kind of people go like one route or the other?
Yeah, so I tell people my goal is to kind of help meet you where you're at, because everyone's goals are different and every couple's goals are going to be different. I have some patients that are straight natural medicine. That's all they want to do. They don't want to do any type of conventional treatments. I have some patients that are going through IVF, but they want to enhance their ability to make that first round of IVF successful, or, second round without, having to do it over and over. So I really work with people where they're at. Of course, treatment might look different. There's certain things I don't do if they are going through an IVF process with like certain herbs that can impact hormones, just because if they're taking medications for certain things, there's some overlap in things they don't want to take. But I help people with what their goals are. And so that does look a little different from patient to patient.
Yeah. Yeah. So if somebody's kind of coming to you, so let me go back. So I saw something that you had posted that I was like, oh my gosh, you don't really hear people talking about that. Maybe how underlying health conditions, like maybe something with your gut, could be impacting your chance of getting pregnant.
For sure. So gut health is becoming this big thing that's talked about in all aspects of life, and seems like right now in healthcare. And that's because our gut plays such a profound role in our overall health. Even going back to birth, this is when the gut is really essentially developing. It's starting to develop in utero, but the first exposure that a baby has to essentially bacteria in the outside world, it comes from their delivery, whether that's a vaginal birth or a cesarean birth. The bacteria from both of those places can be very different, and that can impact how the microbiome in the baby begins to develop.
Yeah.
Breastfeeding versus formula-fed babies can also impact how the microbiome develops. And so there's a lot of interesting research that looks at that. So all of this plays a big role in what our health looks like as we age into adulthood and, beyond. And there's a lot of factors that can influence this in our life and what the health of the gut looks like. So to kind of give people a general idea of what leaky gut is and what this means and how it can impact things, I like to think of the gut as a garden hose. Essentially, we have the end of it as our mouth, or the beginning of it is at our mouth, and then the end of it is the end of the hose, and our rectum. So as we put things into the hose or water into the hose and it moves through, if there's no holes in the hose, it comes out pretty well at the end. And our gut is kind of the same way. If there's nothing wrong with our internal organs, it moves through. We have no issues with digestion. However, if someone steps on the hose, or there's a kink in it, or it gets ran over by a lawnmower and there's a hole in it, and we kind of apply this to the gut in the same manner, maybe there's antibiotics that start to disrupt the flora or the bacteria in the gut. or there's things like NSAIDs or different medications that can start to disrupt the lining of the gut. This over time can create just inflammation or issues to the gut that over time can make it difficult to digest nutrients, to digest food properly, for our bodies to produce the bacteria that we need for all these things. And that, of course, can lead to the leaky gut. How this can influence our reproductive health and pregnancy and even miscarriages is if there's a lot of inflammation building up in the gut, we will also see an increase in immune response. So an increase in immune molecules or immune cells and inflammation kind of go hand in hand with one another as they both rise together, essentially. So if there's a lot of inflammation present, this can create more immune cells. And if leaky gut is present, those cells can move to different parts of the body, some of which could be the reproductive organs. So there is some research that's shown inflammation from the gut can affect pregnancies. Different immune cells can attack or cause issues to the placenta during pregnancy at times. So those can be some ways that we do see issues with gut health and pregnancy. And if the woman isn't pregnant yet, this can also create inflammation in the organ system, which may make implantation difficult, and kind of other things like that as well.
Mm-hmm. I love that you kind of touched on the birth process, because those are elements that are out of our control. Like what happened at birth to us, sets us up for a certain roadmap that wasn't necessarily in our control. So there are certain cards that you're dealt depending on your mode of birth and, different things that happen your first few years of life. So like, are there things that we can do now to reverse stuff that like kind of set us up, let's say, that maybe you didn't have a vaginal birth, and like I know quite a few people at my age who were like cesarean birth, formula fed, and then like we're on a lot of antibiotics. You said yeah, and then like we're on a lot of antibiotics as kids because that's just what our parents did because they didn't know any different. And that does impact that gut health, and so those are the cards that you're dealt. So how do you like deal with that now?
Yeah, great question, because it's like I've worked my life to heal my own gut, and because I've had issues with that throughout my life. So I think a lot of things it comes down to diet is a really huge factor, of course, and that is something that we do have control over at some point in our life, obviously. The food that we eat is going to feed the bacteria in our gut. So the consistency and having a well-rounded diet, not just eating the same 5 foods all the time. You want to have diversity in the diet. This is a thing that I talk about frequently with my patients, is even if you're eating healthy foods or really, really good foods, essentially, if you're eating the same 3 things or 10 things all the time, that's going to promote the growth of the same bacteria over and over. Whereas if you can introduce different types of food into your diet, whether it's different types of grains or fermented foods or proteins, those are going to promote growth of different bacteria. So to enhance the diversity of the microbiome, we want to have diversity in our diet. The other thing that we can do is, because there are some things people don't have control over and whether it's medications or things that they're doing, but looking at taking probiotics. If you are on antibiotics for whatever reason, maybe take probiotics afterward to restore the microbiome in your gut, because this can also influence issues in the vagina. I think most women, probably not all, but at some point in our life, we've probably taken an antibiotic and then had yeast infections later. And it's like this vicious cycle of now you're taking something for the yeast infection, and then this yeast is just recurring every 5 times in a year, and it's like, what the heck, where did this come from? So trying to support our body, not just for our gut but also our vaginal health, is kind of a good place to start. Another thing too that is becoming more talked about in our, I guess, society or in the functional medicine world is the oral microbiome. So we have microbiomes in like every system in our body. But because the mouth is the first place that digestion begins, if there's issues in the mouth, that can lead to issues through the rest of the digestive tract. So another place people can kind of start with trying to improve their health is, if you are having dental issues, maybe finding a holistic dentist or a functional dentist that can, help with whatever issues you have going on. I don't know a ton about dental work. It's not my area.
Yeah.
But the microbiome in the mouth can influence the rest of the gut. And there are bacteria that can live in the mouth that also live in the stomach that can,
Right.
again, influence the rest of our health. So kind of looking at your whole body to support your gut, that's kind of I don't know, I got really, I guess, kind of sidetracked on that answer, but those are some things that I really work to focus on with my patients, is increasing diversity of the diet and looking at all systems of your body and how you can best support them.
Yeah. Well, it is all connected. Like you
Mhm.
said, I mean, you can start working on gut health and other things, but it's like, okay, well, if you're a mouth breather and you sleep with your mouth open and you had like a root canal done years ago and there's an underlying infection festering that you don't know
Mhm.
about, you don't know how that's impacting your health. Like there's
Yeah.
so
Yeah.
much that it's like,
Exactly.
like,
Yeah. Yeah. Like I have a patient recently who had a lot of gut issues going on, and, it was like getting better, the stuff that we were doing, but she ended up seeing a dentist and he was like, there's a really bad infection under an old root canal. And it was like, well,
yeah,
this is causing a major issue in her
yeah,
hormones and her thyroid and her cortisol. It was really stressing her whole system because it was this major stressor in the body that really wasn't being addressed, essentially. So all the
yeah,
probiotics in the world might help a little bit, but like it's not going to fix that issue. So
right. Yeah,
yeah.
that's wild. I recently saw somebody that I follow talking about how she went to this dentist, and I don't even remember what it's called, but she had her wisdom teeth removed like 20 years ago. And they did this scan and found underlying infections from where it healed. And so
Hmm.
they go in and do like this laser treatment to clean it out. And I was like,
Hmm.
oh my God. Of course, everything I hear, I'm like, I want to do that now.
Yeah.
Like 10 years ago, I got like my mercury fillings removed. So I'm like, oh my gosh, I want to like find a dentist who does this now, because mine were impacted. So they had to like surgically remove
Oh
my
my gosh.
wisdom teeth. And so I'm like, I probably have underlying infections that's affecting my gut issue. Like my husband's like, okay, you need to calm down
It's like,
on everything. Right, right, totally. But you brought up like the vaginal microbiome. So I'd like to maybe talk about how that could potentially impact fertility. I know that just since like having babies and stuff, things change down there, and I feel more prone to like
hmm
yeast infections versus before, not really.
hmm
Um, but I feel like I'm definitely way more sensitive in between kids and like having kids. But in my early 20s, I remember I'd get like quite a few UTIs. But I found that it would happen when I ate a lot of sugar, or I was like out partying and drinking a lot, and didn't have enough water, and my almost or like at the beach all day. Like I was
hmm
just sensitive down there, and I could tell if I was getting one. And I mean, I haven't had one in years, and probably over a decade now, because I kind of like learned, I'm like, oh
hmm
my gosh, like when I eat a ton of sugar or drink a lot of alcohol or I'm dehydrated or in a swimming suit all day, like I just feel like I'm getting a UTI the next day. And I would drink a ton of water, do some like cleansing stuff, and then I'd be fine.
hmm
But I'm like, there has to be like some connection, because some people are like, oh, I don't know why I get UTIs. I'm like, well, there's a reason,
Yeah. Yeah.
like,
Yeah. And with UTIs, the most common bacteria that causes it is E. coli, which
hmm,
comes from we pass that in our stool. It's part of our normal microbiome. Depending on where it's at in the tract, it can cause infections if it's in areas we don't want it to be in. But that's the
yeah,
most common bacteria that causes UTIs. And I mean, really, it's just because of the proximity of all of our orifices. They're all
yeah,
really close to one another. So some of it, if you think about the really basic things that I'm sure you're doing and probably most women are doing, wiping, front to back,
yeah,
peeing after sex is a huge one
right,
because we're really, really close to someone else's microbiome at that point, and bacteria can move around, even if it's from them or if it's from us. There's things with that can help. And then you had mentioned being in a swimsuit all day. So a lot of women will comment that they're more prone to yeast infections, maybe not even with a swimsuit, but if they're wearing yoga pants or like spandex shorts where it's just
yeah,
really tight fitting clothing. So kind of speaking on both the vaginal microbiome and the urinary tract, the microbiome there, there's different bacteria that exist, and we need it to help maintain a healthy pH. So the vagina naturally is very acidic, and this is to help prevent infections from moving into the vagina through the cervix and infecting different parts of our reproductive tract. And it's also what's kind of needed for when you're trying to get pregnant, because it's an environment that's more, I guess, what the sperm kind of prefers essentially. And the microbiome, or the pH of the vagina, will actually kind of fluctuate throughout the month, because the vagina is acidic, but our cervical mucus and period blood tend to be a little bit more alkaline, or a little bit more basic. So that kind of changes. And then semen is also more basic. So we have all these different pHs that can influence the vagina. And because different bacteria exist in more acidic states or more basic states, that can impact the type of bacteria and yeast that live there essentially. So for instance, bacterial vaginosis is going to more often cause a more basic or more alkaline vagina, and that's going to promote growth of different bacteria. Some of these bacteria, I hope I'm not going too deep into like microbiology here, but some of these bacteria are called aerobic, and we have anaerobic bacteria. Aerobic means that they need oxygen to survive and grow, and anaerobic means that they don't. So in bacterial vaginosis, or when we see kind of this dysbiotic state in the vagina, it can increase production of anaerobic bacteria, which if you're wearing tight fitting shorts or underwear or swimsuits, it's creating this like warm, moist, I can't believe I just said moist on a podcast.
That word does not bother me at all.
Okay.
No.
I was like, oh, that was not intended, but it creates this kind of preferred environment for this bacteria to thrive. Yeah. And so that can cause recurring infections. And then a lot of women will tell me, I start to get itchy during my period or leading up to the period. And that's because period blood can make a difference. Some women notice it if they're having sex more regularly, and that can be due to not their like partner's specific semen, but just the fact that semen in general is a higher pH. And so all of this disruption to the tract can make people more susceptible to different infections. Now, speaking on the urinary tract, because it's so close to the vagina, there's a lot of, kind of back and forth with the bacteria that are there. So kind of the same things that I mentioned for the vagina can also impact the urinary tract and can make you more susceptible to different infections. There's an anatomical factor there too. Some people that have shorter urethras might be more prone to infections. That's why women generally get them more often than men. We have shorter urethras than men do. So that's why we're more prone to that. But those are kind of some ways that can influence that. And then of course, you start taking antibiotics or antifungals, and then it just makes this process get worse and worse and worse. And yeah, then you're kind of stuck in this vicious cycle of recurring infections.
Mm-hmm. Which could impact fertility. Yeah.
And so because we want a more acidic, I forgot that was the original question, because we want a more acidic environment to get pregnant, that's kind of what's considered ideal. We produce more alkaline cervical mucus, which of course is going to help get the sperm. I'm sure you've talked about cervical mucus before in your podcast and are aware of it, because it really helps with helping the sperm move up the cervix and to meet the egg. So if there's issues there, it can impact the ability for sperm to move through the cervix or sperm to move through the vaginal canal. It can impact, and of course that can play a huge role in fertility if the sperm isn't able to get to the egg. And even in some cases, undiagnosed or untreated cases of bacterial vaginosis can actually, if they get bad enough, lead to inflammation in the reproductive system and could contribute to PID or pelvic inflammatory disease. And what's interesting with bacterial vaginosis, about 30% of women have it, and 80 of those women, 80% are asymptomatic. Wow. So that's a pretty high percentage of women that may be dealing with just chronic vaginal issues that aren't aware of it. And sometimes the symptoms are super obvious. The things that we all think of when we hear infection: itching, increased discharge, maybe pain. But sometimes it's very subtle, or there's just no symptoms at all, especially if the longer they've had it, the more, I guess, used to it they might get. And then with bacterial vaginosis, the rates of that infection are higher in couples of women that have sex with women versus women that have sex with men, just because it can get passed back and forth between partners, a bit more. So that's something that if I'm working with a patient and we're not really unknowing, maybe their gut health is really, they're not really having issues with it, but they're having difficulty conceiving. Maybe they have a history of just vaginal issues or urinary issues. That might be something we look for to see, do they just have are they just asymptomatic? Because that can potentially lead to issues in the reproductive system and implantation, and even just the egg moving out of the fallopian tubes.
Yeah, that's crazy. I didn't know that statistic with BV that like 80% are asymptomatic, because you always hear, so after I had my first postpartum visit, she said like that I don't know, she did a vaginal exam and she's like, you look a little like yeasty down here. And she, did a culture and it came back that I had BV, and I had no idea. And I had never had it to my knowledge before in my life. And when I like looked up the symptoms, they're like strong fishy odor and, and I'm like, I wasn't itchy. I didn't have like a weird smell. I didn't know at all, and plus you're postpartum, you're like, there's things coming out of me. Like,
like what's normal anymore down there.
Right. I don't know like what discharge was normal. It's my first baby, like coming out of me postpartum. And I had no idea about it. So, I mean, that makes sense, but like you wouldn't really know if you had it chronically, if you have no symptoms, unless other issues start popping up.
Yeah, for sure. And you can go really deep into looking at the microbiome in the vagina. There's what's called community state types, or CSTs, and it's kind of a grade, or it helps basically tell you what type you are. And there's 5 different types. And this varies from woman to woman, but we even see differences in like percentages across different ethnic groups as well, which is just really interesting. So as a practitioner, that's something I keep in mind of, depending on the patient that I'm working with. But there are certain ones that are considered normal. That is like the ideal microbiome to have. And there are some that are normal but can be associated with fertility issues or reproductive issues. So I had a patient recently who hers was normal, but put her at an increased risk of miscarriage, and she had a miscarriage. She'd have a few chemical pregnancies already. So that was something that we worked on with her. And she also was having some urinary issues. She had some like crystals coming out in the urine. So we did some work on her urinary tract. We did some work with the vagina, and she's maintained the pregnancy so far right now, which is the furthest she's been, I think, yet. So that does show how big of an impact something, even what we would consider maybe super basic, can really have a pretty dramatic impact on our reproductive health and fertility.
Right. And those aren't things that necessarily IVF doctors are checking for.
No.
Right. and so it's like, if you're paying all this money to have a baby, and then you're having a miscarriage or it's not sticking, and you have no idea that there's these underlying issues, that would be so frustrating. So it's kind of like I'm a huge fan of like root cause things. So it's like, I feel like you should work with a functional medicine doctor, and then, then do the more invasive thing. Just because it makes sense. Like, if you want your best shot of this working out, if you want to make sure that there's nothing in your power that you know of that could disrupt this, like, you'd want to do it. But there isn't education around that. They're just like, oh, right. And it can be frustrating because I had a friend recently go through IVF, and I don't know tons about it, but she was telling me, what she had to do, and that she had to get on these antibiotics. And I'm like, did your doctor tell you to take a probiotic afterwards? And she's like, no. I'm like, well, that's probably a good idea. Like, you're entering pregnancy. You need to like have some gut microbiome set up to like help with this, because that also affects your baby's development of their gut microbiome. And but there was just like nothing, he was like, get on any prenatal and
Mm-hmm.
that's it.
Yeah. It's unfortunate that there's not more support with even just really basic things
Right.
like what you were just describing, because even if we talk about after, while during pregnancy, like past the conception state of things, women that have a healthy microbiome, it's just going to make the pregnancy overall likely a little bit easier on them. Maybe they won't be dealing with constipation as severely. It might still happen because it's just the body changing and progesterone, and that could play a role, but it might help reduce symptoms that they might be experiencing. They might feel better throughout pregnancy. There's a lot of research too and that's what's also interesting, is there's so much research on all of this, but it's not
Right.
necessarily being clinically applied. There's a lot of research of the microbiome changes drastically during pregnancy, one, to help protect the baby, and two, to help basically prepare it for birth, which, the body ideally wants to have a vaginal birth, but of course, there's complications that arise, and that isn't always what ends up happening. But by having a healthy microbiome during pregnancy, like you were saying, it might help improve their health after birth, and then also, just the pregnancy as a whole, because from a genetic standpoint, the health of the mother and father prior to conceiving can really dictate what the health of the child looks like even years down the road.
Right.
And exposure to different bacteria can reduce risk of obesity and diabetes and things like that. So I know we oftentimes, when we get pregnant, I mean, I've been there myself, we're thinking of this really small moment in time, which is the pregnancy and the birth, but really the life of the child it's beyond what even what we will even see with our children. They're going to live long, hopefully outlive us. So
Yeah.
there's a lot of things that I consider when I'm working with people, is not only do I want you to be able to get pregnant and stay pregnant, but I want to help set the stage so that your baby can be as healthy as they possibly can over the course of their entire lives. So there's a lot of, when we don't always have that much control, but if we're in a
Right.
setting where we can try to help those things, then of course that's, what we want to focus on.
Right. That's definitely not talked about either. It's just kind of like, it's like you get pregnant and then, you hear so many times that like, basically it doesn't matter what prenatal you take or like what you're eating, the baby's going to take what it needs.
Mhm,
And that's like not necessarily true. Like they're going to take what
mhm,
they need for sure, from you, but they might need more. They might need
mhm,
something else. You might not be getting everything that you need. Plus then you're going to be depleted.
mhm.
And yeah, we don't really talk about how our health during that season also sets the stage for our children's health.
Hmm. Yeah, and I'm sure, one thing this, I know, is this fourth trimester, right? This is like never talked about. We're starting to hear more about postpartum anxiety and postpartum depression, but it's totally, I mean, myself, even as much education as I have, when I was experiencing that for the first time, I was like, oh my God, what is happening to me? And
Yeah.
how am I ever going to feel normal again? And it is challenging because we become so depleted during that process of labor and delivery that we don't think about how to take care of ourselves after. And then of course, being in the United States, it's just like, okay, you got to like go back to work as fast as you can, because that's just how it is here.
Right.
So
I know, it blows my mind. My husband and I were like just talking about it because just how birth really is a big event. Like not only like physically, but mentally, spiritually, emotionally, like so much. And then lately I've been just like hopped up on how like cesareans is like the most common surgery that
mhm,
performed in our country. But
mhm,
yet every other surgery, if you have a knee surgery, which is also like one of the top common surgeries, you get prescribed physical therapy.
mhm,
Like with a cesarean, there's nothing like, I'm like, you have a cesarean, they give you the list of like, yeah, don't do this, don't do that, but there's
mhm,
zero support for it. And
mhm,
there's like zero other information, even
mhm,
just like nutritionally how to recover, things you can
mhm,
do with your scar, things that
mhm,
you can do to really help your body, You just had a major surgery, and our society treats it like it's no big deal. And so do moms, you know, they're like, oh yeah, I just had another C-section, whatever. But that's because we've treated it that way. And it's like, no, you need to let your body heal. You need to let your body recover. Like, that's great that you felt great 3 days later, but you still shouldn't be running up and down the stairs. Like, you know,
yeah, exactly.
But we're just like, it's just like, I think we just think like, oh, women do this all the time, which they do. But if that role was reversed, so if men were getting cesareans every single day, like this would just be a completely different scenario. Like, you know how sick they are when they get the man flu. It's I know my husband's the worst. He's like, I feel like I'm so sick. And like, we have no choice but to like take care of everybody else in our family and keep going. It's like, even when I'm sick and I feel terrible, like I don't have time to feel terrible.
Yeah. I know. My husband said to me after birth, he was like, I'm really glad it was you that did that, because I don't think I would have survived. And I was like, I appreciate that. You know, thank you for acknowledging how difficult that was. But yeah, it's crazy, you know, it's interesting society we live in, where it's like, you have to go back to work. One of my friends had a baby recently, and she's like, I'm halfway through my maternity leave already, and I'm still waking up every 2 hours and dealing with mastitis. And, you know, how am I, how do I do this? So yeah, it's crazy.
So I'd love to talk a little bit more like about the vaginal microbiome. Is there a way to, I guess, test that? Like, let's say somebody's listening, maybe they're not struggling to conceive, or maybe they are, but they're just like, I'm just like curious if I have some sort of issues going on. Because I also know that there's tests there to like help you. I know there's a lot of different companies now that have come out with like vaginal tests to test the microbiome, and how maybe you can optimize that for your birth so that your baby's passing through like even more beneficial bacteria.
Yeah, so there's a company I work with, Microbiome Labs, that we can order basically what I was telling you about, where it kind of types the community state types or the CST that you are. And this can also help see, you know, it's not testing for STDs or pathogens, but it does look at what does your microbiome look like. There's another company called EV or EVVY, and they do that type of testing as well. And those can be, I think, really beneficial. And some women might just be curious, especially if they've had a history of vaginal issues or urinary issues. But yeah, that can be, and it's great because you can just do it at home. You do a swab on yourself, and then it gets sent out in a kit. So it's taking out the need to go get a gynecological exam. That might be needed for some type of testing, of course, but for this, what we're talking about, it's a pretty basic test.
Yeah, I actually had one of the founders of, I think it's pronounced Evie, but I'm not sure.
Okay.
Yeah,
you're probably right.
I had one of them on the podcast like a couple of years ago. And it was super interesting, like learning about the vaginal microbiome. And because again, that's like, we're just learning so much. Like that's something our parents didn't know anything about. And so now, you know, we're like talking about the like, wait, what? But yeah, for me, I'm just like, I'm curious. I like to like know things that are going on in my body. So I've been wanting to do one this pregnancy, but I haven't done a test, but I should, just out of curiosity, see what's going on. Because like I said, I just feel like between babies, like things change, you know, and in pregnancy and postpartum and that time, like there's just so much going on. So they're like, hey, you're gonna have some leukorrhea, which is like normal discharge during pregnancy. And it's like, okay, so what's normal, what's not? Like I feel like you never know.
Smells change. You're like, I've never smelled like this in my life.
Right, totally. And I know just even like getting, even with BV, like that's something, like you said, it increases like depending on like your partner and stuff. But do you know if there are like certain things that like certain people's bodies or chemistry like just don't match great? So like you're with a partner, like you're with your husband, and you chronically get these things. Is there like, I don't know.
Is it him? Is that kind of what you're asking?
Yeah. Like, is it him? Is there just like, I don't know, our fluids just don't mix well, or what?
Yeah. I mean, of course, I think there can be some that can be some factor. I mean, we can't say it doesn't play a role, but I think the bigger thing, if people are noticing that they're consistently having issues after sex, it probably means that it might be like their vaginal microbiome might be kind of primed, and this is kind of the trigger that's setting this like issue into motion. Is likely more of what's happening, because in a perfect world, there shouldn't be any issues when you have sex. You shouldn't have any infections if everything is quote unquote perfect. But obviously we don't live in a perfect world. So I think that it's more, there's potentially issues already happening, or there's a microbiome that might be considered less than ideal. And like I had mentioned earlier, with the semen being more of a higher pH, if there's something going on in the vagina, like a really acidic vagina, really acidic state, sometimes can be caused by a yeast infection. Yeast can sometimes make it even more acidic. Then you have this really acidic environment and this really basic or more alkaline like semen, and those two things mixing can also create a not ideal it can really impact the microbiome. So I think it's probably more there's something else going on already, and that could just be making the situation worse or like enhancing it essentially. So I do have a lot of women that say their periods make it worse, and that's because the period blood is a higher pH as well. Right. So that could be, I think that's probably more of it. That's just my opinion.
Yeah. I'd love to touch on balancing hormones naturally, because that can also be an issue with trying to conceive. It can be an issue entering pregnancy. And again, this is just like something for the most part that women are dealing with, not men. But we know that hormones play such a huge role. And when people think of hormones, they think of like estrogen and testosterone and maybe progesterone. But it's like, there's so many other things that are hormones in our bodies, like cortisol and vitamin D, like those are technically like hormones. But let's say somebody's listening and they want to try to conceive soon, but they just want to make sure that like maybe their hormones are in a good place. Are there like some things that you can do on your own just to like help keep your body balanced?
So it's a great question to kind of segue into this next topic, because our hormones, of course, can also influence the microbiome in the vagina, which is pretty cool. For example, if estrogen levels are really low, this can make the body it can shift the state of the body or the bacteria that exist in the vagina. We commonly see this during menopause when women's hormones naturally decline, and that kind of shifts them into a different realm essentially than where they may have been at when they were regularly menstruating. But we can also see this happen in women that are of menstruating age, or who are trying to conceive and maybe have low levels of estrogen. This can also shift the microbiome as well. So to kind of go back into your question about estrogen and these other hormones, we need estrogen in the first part of the cycle, or the follicular phase, to help with to basically help us get to the point of triggering ovulation to occur. Each month, the ovaries produce a number of follicles, and these follicles will start to begin on, they'll start to grow in the first few days of the cycle. And eventually one of those follicles becomes the dominant one, and that's going to be the egg that will be ovulated. The increase in follicles also helps to increase the estrogen production. So as estrogen peaks in this part of the cycle, we'll just base this on a 28-day cycle with ovulation at day 14 for just explanation purposes. Estrogen will generally peak around day 12-ish. This is going to signal the brain to release LH, or luteinizing hormone, and this is what triggers the ovary to release the egg, and that's when ovulation occurs. At that point, estrogen levels should drop, and there's kind of this small window where progesterone and estrogen are both a little bit lower, like right after ovulation. Once ovulation occurs, there's this little structure left over in the ovary called the corpus luteum. And this is what's going to secrete progesterone. And this is where the luteal phase name comes from. So in the second half of the cycle, we should start to see an increase in progesterone. And there's a little bit of an increase in estrogen, but it doesn't go quite as high. But we do see a little bit of an increase again. If at that point the body recognizes that it's not pregnant, it slowly hormones start to decline, and then the period starts. So it's kind of the perfect cycle, essentially. Now, one of the most common things I hear from women is they have low progesterone. And then I also see a lot of patients that have like PCOS, where they maybe have higher levels of testosterone or DHEA, and maybe they have low estrogen or low progesterone, or they're just not cycling at all. And that's some of the more common things that I see. So I don't know if you have any questions you want to ask as I continue to kind of go into that. So one of the biggest things, like I said, that people have questions for me is, how can I improve my progesterone production? Because it's one of the most common things that we see, or that I see, and we need progesterone to maintain a pregnancy. Progesterone, and what's also really interesting is the corpus luteum, even during pregnancy, will continue to produce progesterone until about week 7 to 9, it kind of varies. And then the placenta will take over and will start producing progesterone at that point. So I do find that it's interesting with women that have or maybe are having really early miscarriages, if it's in that, week 6 to week 8 window, or they're constantly not being able to get past that point. I think that there could be issues with the corpus luteum not producing enough progesterone because the placenta hasn't yet taken over. Because we don't commonly hear that once women are in the 2nd or 3rd trimester that they're having issues with progesterone. I'm not saying it doesn't happen, but it's not as common, and the placenta at that point can generally make enough. So kind of where I go with that to help people is, okay, one of the biggest factors that I see for low progesterone could be stress to the body, or HPA axis dysfunction, which is kind of what regulates our cortisol output, essentially. Yeah. And if there's a chronic infection, like we were talking about in the gut, maybe there's nutritional deficiencies. Vitamin D is a super common one that I see because it's not as regularly checked. And people think, I live in a southern state, I can't be vitamin D deficient, but I have seen vitamin D deficiency in people that live in Florida, so it is possible. So I usually work to kind of address whatever those issues look like, and hopefully we start to see a natural increase in progesterone production. And that's kind of one of the hormones we can start with.
Right. Yeah, I know that like with progesterone that is a common factor that contributes to early miscarriage. So do you have to like what's the best way to know if your hormones, I guess, are in balance? Because I think even like a lot of people aren't even that familiar with their cycles. It's like, I have a period every month. I'm not sure when I ovulate, or if I am, or they might be like peeing on some sticks and they're like, yeah, it's showing that I am. So I think everything's fine.
Yeah. So one of the best ways that I tell people is to know when know how to track your cycle. So for those of you that don't know, day 1 is going to be the first day that you're bleeding. And then the first day of your next cycle is when your next period starts, and you just count forward from there. So in a 28-day cycle, ideally ovulation is going to fall day 13, 14, 15, pretty much mid-cycle. So if your cycles are a little bit longer than that, then you shift that window. If you have, 32-day cycles, then day 15, 16, 17 is ideally going to be where ovulation falls. And it might vary from month to month. Like you might be day 15 one month, day 17 another. But what we don't want to see is some months you're ovulating, let's say in a 30-day cycle. We don't want you ovulating on day 15 and then day 21 or day 9. That's a pretty big discrepancy. And why we want it to be mid-cycle is because of the natural production of hormones. So, and also what I see in a lot of women that have low levels of progesterone, they might ovulate on day 20 of a 28-day cycle. So we went from ideally having almost 14 days for progesterone to build and, eventually decline, to now there's this short 8-day window. So progesterone levels probably aren't going to be able to get as high as needed. And that also might reflect back to the first part of the cycle, where we need estrogen to trigger ovulation or to trigger LH production for ovulation to occur. So maybe estrogen levels aren't building early enough in the cycle, and that's why ovulation is happening so late. So that could be something too. And some women, typically for blood work, day 3 of the cycle is when most hormones will be checked. So estrogen, FSH, LH. When we want to check progesterone is typically about 5 to 7 days after ovulation occurred. So this is where tracking ovulation becomes important. I do see a lot of women using LH strips, which I think can be helpful, but I try to encourage my patients to not let it be the only thing that they're using to track their cycle, because it's not 100% accurate. And in cases of women that have PCOS who have chronically elevated LH levels, this isn't going to tell them anything because it might always show high. So basal body temperature is one of the big things that I encourage women to do so that they can see a change in their temperature when ovulation occurs. And using that with LH strips and then also tracking cervical mucus can be really helpful for women to see, what does my fertile window look like? Another not as reliable thing, but I think women typically notice as generally libido will start to increase around ovulation too. And that's our body's natural way of saying, let's get pregnant, let's have sex and get pregnant right now. So those are all things that I do recommend people doing. And the more comfortable you are with your body and knowing what's normal for you, the easier it becomes to note when something is abnormal for you. And I think what you kind of hit the nail on the head by saying not all women know what this is. I mean, I remember I was like 16 and I'm like, okay, I take my 3 weeks of birth control pills and then I don't take it for a week and then here we go. And it's just the lack of knowledge around it is hard because we've never been taught how to do these things on our own. But that's a big thing that I work with people, is to just help them understand what's happening in their bodies, because then we have more points to recognize what's abnormal and what hormones we need to look at to see what else is going on.
Right. Yeah, I feel like my cycles were after I always had 28-day cycles until after I had my last daughter, and then they were 31 days. And I would usually ovulate around day 17. Just based off of my tracking. However, when I got pregnant with this pregnancy, something was not right.
And it's totally, if you're ovulating, there's always a possibility of pregnancy, regardless of where it's at in the cycle. I had a patient at one point, she had like a 40-day cycle, and she was like, I don't know why I'm not getting my period. And she's like, I'm pregnant. I don't know how I ovulated on day 30. And she got pregnant and had a baby. So, I mean, it is possible.
Well, I was tracking my ovulation to actively not get pregnant.
Oh, okay.
So I messed up somewhere in there. There was a slip up. But I'd love to know, maybe what are some of the symptoms that, other symptoms, because let's say you're not tracking your hormones, because it does sound like a lot of work to a lot of people. They're like, oh my gosh, I have to do all of this stuff. How could it show up in other areas of your life? I know for me, I had excess estrogen, and my periods were awful. And, just like some other things, I know that there's a lot of things that we have been told are normal, but they're not. They're common, but it doesn't make it normal. So maybe what are some other signs that your body's telling you, hey, your hormones are off, you might want to do something else?
Yeah. So big thing is the PMS window, because, most of us have been, taught our whole lives that, you just turn into a raging, witch the week before your period, and you eat chocolate and you have cramps, and that's just it. You have this for 30 years now until it's over. And that's, like you said, common, but not normal. I remember even when I was a teen, I had some cramps that were so debilitating, like lying in the fetal position in my bedroom crying because I was in so much pain. And, my mom's trying to help me, but she's like, this is what I had too. So this is just normal, I think, take some ibuprofen. So That's a sign that things are not normal. Now we know. But some other things I see are even like I always tell people your period coming might be a minor inconvenience in your life, but it should not affect your ability to live your life day to day. So if you're maybe a little bit more tired, okay, could be normal. If you're like, I can't get out of bed, or all of a sudden I need 8 cups of coffee in a day to function, not normal. Maybe you have a little bit of discomfort or like a little bit of bloating where you're like, okay, my tighter jeans that I wear at the beginning of the month, maybe I can't wear now. Normal. If you're to the point where you look so bloated that, wearing anything is uncomfortable, or you're needing to constantly take pain medication for it, that is, not normal. Other things, some other uncommon things people might not realize is if sleep is starting to be disrupted, because progesterone helps to calm our brain a little bit more. It helps to kind of offset symptoms that we might get from excess estrogen. Progesterone helps to kind of offset that. So it should help us feel more relaxed, more calm. We should have better sleep. We might have, we should continue to have normal bowel movements, but if we're potentially low in progesterone, you might have more diarrhea. You might notice more anxiety. You might notice issues with sleep all of a sudden, more cramping in like the uterus, but also in the legs and the back. I remember when I was a kid, they like went down to my knees. It was awful. And then symptoms of high estrogen might be those same things. There's kind of an overlap of low progesterone and high estrogen can kind of look similar. So sometimes that's hard to tell without testing, but high estrogen can also cause breast tenderness, a lot of the same symptoms. And you also might be more constipated. Some women go back and forth, which can also can be fluctuations in hormones, might also be related to just issues in the gut, or, kind of back to the microbiome like we were talking about too. And then the just changes with moods can be a big thing too. High estrogen might make you feel a little bit more sad or depressed, might also make you more rage or just like irritable or easy to anger as when I say with my patients. It sounds nicer than being rage. But those are some symptoms that people might see as well. And if they're noticing breakouts like acne on the chin or on the neck or kind of in this region, could be related to fluctuations in estrogen or progesterone, might more be related to high androgens like testosterone or DHEA. And this can also be related to maybe excess cortisol production or like from increased stress. So I think it's easy to identify that stuff might be hormonal, but sometimes it's not. Sometimes it is a little obvious to see which hormones might this be, but it's not always obvious what hormone is causing this issue. I see a lot of patterns, so I'm kind of able to guess generally pretty well, but I do usually test just to be certain of, what I'm doing and recommending to people.
Yeah. I used to call it the period shits because I'm very like regular pooping. But before I'd get my period, I like wouldn't poop for a day and then I would have diarrhea and then I would get my period. So, like if I go a day without pooping, it's very, very weird for me. Even in pregnancy, like I've never experienced constipation. I think postpartum after my second, but I feel like it's also because of my hemorrhoids and I'm like, I don't want to poop. But like very, very regular with that. But then when it came, I know I was getting my period because I'm like, I didn't poop today. And then the next day I'd have like very loose stools and then I'd get my period, feel crampy, have diarrhea the next day, get my period, which was always really heavy. So I'm sure it had the high estrogen, low progesterone,
Yeah, and how that can kind of relate back to the gut, because, we can always relate things back to that. Our body goes through, we know that the body detoxes things. Most people know that. And the liver plays a big role with that. That's kind of the first place of detoxification. So when we're detoxing things like estrogen, for instance, goes through 2 phases of detoxification in the liver, which requires a lot of vitamins and nutrients. So if you're not getting enough of that from your diet, or people can be malnourished that are still like an appropriate weight. And we think of malnourished as like really, really skinny. And I mean, that of course is is a factor too. But if you're not digesting fats properly, you're probably not getting as much vitamin A and, E and K as you need, and vitamin D. If you're not breaking down food as well as you need to, it can create excess gas and increase in different bacteria that we don't want, which is going to make it difficult to digest things as well. So we need all those nutrients for the liver to function properly. And for the most part, everyone's liver is, if it's not diseased, it is still working, even if it's not optimal.
Right.
It's not like it just shuts down and doesn't work unless we're looking at like a really severe disease state.
Yeah.
But estrogen goes through these 2 phases of detoxification in the liver. And then there's also kind of this 3rd phase of detoxification that happens in the gut. And we remove estrogen from the body with our bowel movements. So our bowel movements aren't just waste product from our food, but also is all the stuff that got metabolized and detoxed in the liver gets dumped into the bowels, and then that's how we excrete that out of our body. So if people aren't pooping regularly, it can also cause issues with, not getting estrogen out efficiently, or not able to clear it from the system as well. So sometimes I tell people, just aim for more fiber in your diet is a really basic place to start, whether it's foods you're eating or just like taking some actual fiber. And that can sometimes help. Making things more regular can also help support our hormone health as well. So that's kind of how those 2 things are connected too.
Yeah. Super interesting. It'll be interesting to see what my cycles are like after baby number 3.
Yeah.
We'll see. Cause I feel like it definitely changed with all of them a little bit. But our periods do tell us a lot. Like, I love Lisa Hendrickson Jack's book, The 5th Vital Sign. And she talks all about how your period is a vital sign of your health, and that you need to look at your cycle and see what's happening because it's telling you. But we weren't taught any of this in school. Like, we're not, we're taught that, I don't know, that even like saying certain words like vulva is uncomfortable, and it's like, that's part of my body. Like, it's like elbow, vulva. Like,
yeah, exactly. My mom and I have talked about this, and she's like, it's not that I didn't want to, it's just no one told me to teach you these things. And so, like you had said earlier, our parents just didn't know because no one told them. I mean, she's like, I don't know why I gave you cereal as a kid, because that's what the doctors told me to do. But I probably should have been giving you other food that wasn't cereal. Having a daughter now, she's a baby, but my goal is I want her to be able to speak openly about those things. And I mean, even my family, it's just like, I talk about periods and my dad's just kind of like, whatever,
Right.
Like, I'm always talking about something, but my goal is to, help my patients, but I also want people to feel comfortable enough in their bodies that they're able to, we can kind of break these generational, I guess, ideas of, like you said, not being able to say vagina. I mean, how many times have I said vagina on this call already?
Right.
And I'm not going to call it like a private part because it's a vagina. And so if our generation is able to continue educating, hopefully, that just improves things for future women and just people in general, being able to talk about their bodies and know that, periods are normal and it's normal to talk about them. And if we are more open about talking about them, it's going to be easier for women to recognize that something is abnormal in their bodies. Because the number of women I talk to that are like, they're telling me I bleed for 8 days and I'm changing a super tampon every half hour on the first 2 days. I'm like, that is not normal. Like, you are bleeding way too much. And it's not necessarily hurting you, but it's also putting you at risk for, anemia, being anemic, and then you're fatigued for half the month because you're losing too much blood. Also, you're just the discomfort of bleeding that much each month. And, sometimes women are just like, I did not realize that wasn't normal, because how often do we talk with our friends about how much blood they lose during their period? I mean, it's not a regular conversation. So, I think it's, like you said, it's super important to just educate people and use our period as it is another vital sign for us. It's so much of our life is like dictated by our cycle.
Right. Totally. Before we wrap up, I'd love for you to just share a little bit more about maybe how you work with patients and then where people can find and follow you at.
Yeah, so I work with patients virtually right now. It's kind of a thing I got into with COVID and it stuck. So I'm seeing all patients virtually currently. And, if you want to work with me, I do offer complimentary 15-minute consults to new patients to see if we are a good fit. Because sometimes I talk to people and we just might not be the best fit for each other.
Yeah.
And then also to know what people's goals are. Like, I don't really offer quick fixes because all of these things we talk about are things that do take time to work. So if that's what someone's looking for, we might not be a good fit. But I have a link on my website, and then there's a link in my Instagram profile that you can book through there. I also have a link to my website if people want to just read more about me and what I do. And then everything is virtual. So any labs that I order get sent to the patient's house, or you can go out to like a Quest and have your labs drawn. And then any recommendations I give, I send out a script and a list of things, and it basically you can just order directly from there and it gets shipped to your house. So it's very easy. Anything else, like if I feel you need to obviously see a doctor for some reason, I will encourage you to go see your doctor for an exam or a physical, or I can't do a gynecological exam over the phone. And then sometimes I work with people that are seeing other providers too. And, like I said, I meet people where they're at. So that's kind of what the process of working with me looks like. My new patient appointments are 90 minutes, and that's so we have a lot of time to talk about people's entire health history, because talking about our cycles can take 30 minutes sometimes because it's so important. So I like to spend a lot of time with people and really getting to know their history and what we really need to focus on, versus saying do 10 of these tests and some of it might be valuable, some of it might not be.
Right. Yeah. That's awesome. And then before we wrap up, I like to ask, since it's the morning Hava, how do you drink your morning Java?
Well, I got on the call drinking my first cup of the day that I started, 2 hours ago. I always eat breakfast before I drink my coffee because from a hormonal standpoint, it's best to have protein before you eat. So that's my favorite. I'm having regular coffee right now, but I usually do a shot of espresso, and it's usually my go-to.
Yeah.
But it took me a little while because I was taking care of the baby.
Yeah, I know. My husband will be like, why are you drinking cold coffee? Like, he doesn't understand. Like, sometimes it would take me like a couple hours and I'll just like sip on it or forget about it. And then I drink it and he's like, gross. I'm like, I don't care. It doesn't bother me. I'm like, whatever.
As I was getting on the call, my brother's girlfriend was like, are you still working on that coffee? I'm like, yeah. She's like, oh, so you're drinking, it's iced now. I'm like, pretty much.
Yeah.
I did finish it while we were on the call though. So
yeah.
2 hours
Awesome.
later.
Well, thank you so much for your time, energy, and expertise today. I'll put all the links in the show notes to where people can find and follow you. And I just want to thank you for coming on the podcast.
Yeah. Thank you for having me. It was fun. And I love talking about this stuff.
Yeah, me too. I feel like with a lot of people I come on, I'm like, we could talk forever about so many different things. So like at some point it's like,
time's up already.
Right. Totally. But that's why I love like leaving where they can find and follow you, because you do put out a ton of like free information and resources on your Instagram as well. So it's always fun to connect people in that way so that they can see like what you're posting and be like, oh my gosh, I had no idea.
Yeah.
So that's very fun. All right. Thank you so much.
Yeah.